Good afternoon. And so, besides our data points, there's been lots of announcements today. The Premier, Minister Elliott, as other ministers, speaking on the concepts of what would be coming around stage 1 of phase 2. And we'll have some comments to make about that, as that has been, they made everybody aware of that. The issue in the past is that sometimes these came too quickly, and some different sectors, retailers, others said we need a bit more advanced notice before it does occur. And so we're trying to give some lead time and expectation so they can do the proper preparations to ensure that if they're going to do it, they're adhering to the recommendations of the public health measures table to maintain the safety aspects of the 6-foot distancing, the number of patrons that would be going to the different facilities, maintaining protection, sometimes with proper face covering for staff, as well as physical barriers, etc. So have all those things in place if they do choose to move, and if we are going ahead on the day that the Premier announced, knowing that all data and information, but I'll talk about that in a moment. But in light of that, let's look at the data for today. So over to Dr. Yaffe.
Thanks very much. Good afternoon, everyone. Today, we have a total of 21,494 confirmed cases of COVID-19 reported in Ontario. This is an increase of 258 cases, and that's only 1.2% increase compared to yesterday. And I want to note that we haven't had this few new cases on any day since March 31st. So this is a good trend. 57% of our cases are in females, 43% are 60 years of age and older, and 62.5% are people who reside in the Greater Toronto Area. About 16.8%, or 3,607 of the cases, are in healthcare workers. Again, this is a cumulative number, and it does not represent those currently positive. We continue to see Ontarians recovering from COVID-19. At this point, 75% of our cases have resolved, which is about 16,204 cases. We have 1,026 people in hospital. Of those, 184 are in the intensive care unit, and of them, 141 are on a ventilator. Tragically, we do continue to see deaths related to COVID-19. To date, 1,798 deaths have been reported, representing an increase of 33 from the previous report. With respect to long-term care, the Ministry of Long-Term Care is reporting at a total of 185 active outbreaks in long-term care facilities, 1,308 deaths reported among residents, and 5 deaths among staff. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility provided by the Retirement Home Regulatory Authority, 69 homes are in outbreak, 172 deaths have been reported. With respect to laboratory testing, 492,487 tests have been completed in the province. In the last day, 17,429 tests have been done, and 17,578 are currently under investigation. And with that, I'll turn it back to Dr. Williams.
Yes, well, thank you. And yes, 258, as Dr. Yaffe said, the last time we were close to that was the end of March with 260. And there's a difference there, because as we look towards going to stage 1 of phase 2, asking when do I feel about that. And as you know, we've been doing some may have forgotten, I was doing my 2-week periods. The next 2-week period ends on the 17th, that's Sunday, and starts again another 2-week period on the 18th. I guess I didn't realize or didn't put down it was a holiday in that regard. So that's why sometime after the 18th and the 19th was looked at as a potential time for potentially going to stage 1 of phase 2. Why is that? Over the last 2 weeks, we have seen if you look at the linear curve, a decrease in the cases. This one only but adds to that. Not that I wouldn't be surprised if tomorrow went up again. It seems to do that. It comes down, then goes up by a bit, but each time it doesn't go up as much as the week before, and it just keeps downward trending. The other aspect here is you compare to what I said before way in the past, at the start of March, before we were losing and going into community-wide spread, we were getting somewhere in the range of 140 up to 180 cases a day in that, and that was okay. Once we started going over that 180 over 200 cases a day in the community, we started to have some difficulty, especially after the March break period. If you look at but back then, looking at those numbers in the early parts of March, those were all community. There was usually 1, 2, or maybe 4 cases in long-term care, so there wasn't a lot happening in that sector. These 258, as we know from our data, at least 50% of those are from our long-term care survey. That puts us at about 129. So that's reassuring to me to say this is within the ability to do case contact management and going towards containment, knowing that we have more things in place as we didn't have in the beginning of March with our 6-foot distancing, our physical distancing, our public health measures, the number of retailers and the things that are happening, even though the Premier and others have announced a long list that would be occurring with stage 1. These are all asked to say you still have to have the 6-foot distancing. If you're going to offer this service and provision, you're going to have to limit the number of people in your facility. Sometimes you're going to ask some of the patrons coming in, if you can't guarantee all the time the 6-foot distancing, to wear facial covering mask, if you may. And also is there proper protection for the staff, including physical barriers when having cash and other handling aspects in that regard. So they are still going to be asked to say in all these different lists of the ones that are noted to undertake that, and a number of them have put in their plans to the Economic Recovery and Job Recovery Committee, and have agreed that they could adhere to that and undertake to do that, doing some caveats and situations. We're going to open, and we have this, and you need to do this and this in order to do that. So that's that aspect there. And we have to have some more things we're looking at with our committee to say, are we going to look at other aspects around people and their settings and stuff? That's to follow, and we haven't yet made a decision yet. We want to see what the numbers are. So over the weekend, we're going to be looking at the numbers. And to add to this, we'll be finishing the survey of the long-term care facilities. It's gone really well, thanks to all the whole group in the testing side, including the partnership with Ontario Health, with the hospitals, assessment centers, paramedics, a wide number of people involved, and especially the public health units who stepped up and delivered on time, with now over 90% of the residents sampled and well over 80% of the staff, and we still have tomorrow to go yet. So those test results will keep coming in and being taken through the laboratory service over the weekend, and probably all the results and their entry into the data system won't be completed until well through next week, and then we'll see if there's some direction from the IMS group as they review all that data and information. There is some ongoing work with retirement homes, and they continue to monitor those at this stage. In light of that, and because we have the testing capacity, we have made recommendations to open up the assessment centers more, so to ask those seen people coming in either through the self-assessment tool or through telehealth or going to the assessment center, that if you have symptoms that are compatible with COVID-19, that you would be able to get tested. In the past, there had been reasons to say that if you had mild symptoms where there was really no change in your clinical outcome, you'd still be asked to isolate and stay at home, separate from the rest of your family members until the 14-day period. So as far as the physician who is probably overseeing and assessing that, either through the self-assessment tool or through the telehealth, they'd say it doesn't affect the clinical outcome, and you're asked to do that. Now, because we would like to know more about the public writ large, in that we've opened up to say, can we do more testing, and would the public be allowed to come into those assessment centers if they have symptoms compatible? We're not talking about asymptomatic, and we have those lists of those symptoms that are available, will be on the self-assessment tool still, on telehealth and otherwise, to go to those centers and be tested, because now that we've finished the survey, we have that capacity we can use in our public health laboratory system and the network up to over 20,000 tests. And as you can see today, we're well over 17,000, and there's 17,000 pending and more tests coming in. So we may see that number rise even tomorrow and into the weekend in that. So increased testing, increased monitoring. Why? as we do these measures, as we said before, when we go to stage 1 of phase 2, it's for a 3-week period, maybe 4 weeks, we don't know. We want to monitor to say, have we seen any changes that are concerning in that time period? Has there been an uptick or rise in cases identified? Or are they just localized outbreaks? Many things to do and assess at that time. So we're going to look at all those different metrics very carefully during that period of time to say, much like I said before, when we were doing the public health measures, we're going to see how well we did. We flattened the curve. We planked the curve down to some extent, and so Ontarians did the job. They're still doing it. Now, as we're going to say, the next phase, as we open up with more things available to the public in outdoor venues, and you've got a list there, in other things that you may have a need, in a sense it's become, over time, essentiality as people feel desperate to get to do other things. They have to go out there, but you still have to do it with a button there and with a caveat, 6-foot distancing. If you can't maintain that, then wear a non-medical cloth mask in those settings where you know you probably may or will not be able to maintain that 6-foot distancing as more and more people come out in those settings. What we're trying to say in this phase coming up for the next 2 weeks is, while there's things more available, it doesn't mean you have to go out. While there's more things allowed to be open, it doesn't mean they will open. It depends on the retailer, the group, and that, if they want to do it, if they feel it's worthwhile doing it in that setting. So it's basically giving permission in stage 1 to do that, but you have to respect all the things we put in there that are still required. And so we're then going to think about some of the things that we might give to you, what you might be able to do personally in other aspects there. And we haven't yet made the decision. We hope to have some more information on that early next week after the long weekend, as far as the people and gatherings in that aspect there. So we're looking at, as the Premier said, towards the 19th after the long weekend. And as the Premier was alluding to, that's assuming things continue on the way they are over the weekend. Nothing all of a sudden urgently happens. And because we've been pretty steady, some undulations, but coming down, it seems we're on track for that. But we will certainly be clear as we get over the weekend into that. And then that next stage for the next 2 weeks especially, and another week after that, how well do we do with this extra, I would guess, latitude, more things opened up, more people out in the public sector monitoring, doing their carefulness around the distancing, wearing facial coverings. So let's see how we do on that and see if there's any concerns. I can't cover everything because I want to go to questions. And so I'm going to ask to hand over to the media, and we'll ask questions on that, as you've already had a lot of updates from the Premier and the Minister and other ministers earlier this afternoon.
Okay, we'll move to the phone lines.
Your first question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. Just wanted to check, what will the guarantee be that people can get tested with mild symptoms? We had so many calls and emails from people in the early days and even in the last couple of weeks that thought they should get tested and couldn't. So how will we know that people will still be able to get this?
Let's ask Dr. Yaffe to answer that.
Okay, and centers that basically anyone who shows up with symptoms compatible with COVID-19 should be tested. Before that, it was clearly in the clinician's power to decide yes or no, and in fact we had identified priority groups who should get tested. So now we're saying basically the person shows up, they should have an appointment, they have to go through telehealth or their primary care physician or public health unit to get an appointment, but if they show up and they have symptoms, they should get tested.
Follow up?
Yes, thank you. And just to take a question I was asking yesterday a bit further, as things open up, and now we're seeing that, for example, house cleaners can go back and they'll be hopping maybe to 2 and 3 houses a day. Why is there no set testing for house cleaners, grocery store workers, liquor store workers, pharmacy workers? Because it would seem to me that they're at a bit of risk, and especially the housekeepers could be a vector.
I'll start.
You start and I'll follow.
I think the bottom line is we don't want to test people who don't have symptoms. So I would encourage, obviously, if they are symptomatic, they shouldn't be going to work and they should be trying to get a test. But if they're feeling fine and they're using social distancing and hand washing and environmental cleaning, then it shouldn't be a problem. But the main thing is to look for symptoms.
Yeah, and in follow-up to that is that we're coming out of this period of 8 weeks. You should know in that time, if you're a cleaner, if you're a pharmacist, an aspect that you have maintained that 6-foot distancing, you have had no signs or symptoms, no contact with cases, that you should not be infected in that regard. If at the same time you know that you have not been vigilant and you have been in contact and you're feeling well, as Dr. Yaffe said, you should not be going into work, you should not be going to those settings, and you should consider being assessed and tested, because unfortunately you may not have adhered and kept to the limitations in there. I will say that the other differences that you're saying with the assessment centers opening up is that in the first part, the assessment centers are there for clinical evaluation. Now it's for population assessment in that line. So it's a different focus in there. I'm still, if someone has an illness, the physician would say, I think this is concerning. We may want to have you monitored a lot more closely and see us and come back or talk to us, or we may have to consider admitting you. It still can happen, and you still might need to be hospitalized. So the clinical side is still there, but we've added the other aspect of getting assessed. But as Dr. Yaffe said, we want you to call ahead and make an appointment. We don't want crowds of people around outside of an assessment center violating our public health measures. So it should be done in an orderly way in that, and I think it can and will be done that way, because it's going to be like that for the next 2 weeks as we continue to do all this testing. So, and then the situation of the people going from place to place, if they're not infected and they're staying the physical distancing and people are not in the place, they can do those different activities in house to house if they maintain the 6-foot distancing, if they wear proper protection, all those other aspects there, face covering I should say. And so if they should do that, if they do it correctly, it should not be a risk as long as they do it in those type of parameters.
Next question.
Your next question comes from Jessica Smith with Queen's Park Briefing. Please go ahead.
Thank you. Do you see a need for more widespread post-mortem testing in Ontario?
I'm sorry, more widespread?
Sorry, it sounds like you can't hear me. Do you see a need for widespread post-mortem testing in Ontario?
Post-mortem testing. We have been consulting along with our chief coroner, Dr. Dirk Heyer, and they have their own methods of reviewing and their standards about which cases they would require for post-mortem. They did some at the outset, and he's been informed by that information, and we would trust him if he felt there was a need for any further aspects besides looking at chart reviews and monitoring the monitoring the certifications of death, as well as charts to see if there's any concerns. But no, we haven't heard any recommendation from the chief coroner in that regard further than there, but he is involved and will give us advice and direction as he sees necessary.
Follow up?
Thanks. Ontario doesn't collect or collate death data in real time enough to know yet about excess mortality, but if it did, would that data be helpful to you?
Well, the excess mortality data that you saw was based on vital statistics, so all our cases are reported in there. It's a matter of the data being put in the right way to get into Stats Canada. So it's not a fact that we don't have the data. It's the fact that it didn't enter into the analytics at this stage. So that kind of data, if wanted, the chief coroner has full access to that if required and necessary to look at those things. So it was more of a data, vital statistics data flow issue on that report from Stats Canada. So it's there, and if it was informative, the chief coroner would look at it and make decisions accordingly.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
Yeah, hi, doctors. We're getting reports about test results taking 7, 8, 9 days to be put on the portal so that the patients can view them. Why is that still taking so long in some instances?
So you're speaking about the turnaround time for the results, and that has been, identified as an issue in some cases. So we are now working with the public health lab and with some of the health units to do process map to see where are the barriers, where are the issues, and to make sure that it gets better than that. We are hoping that the turnaround time should be 24 hours, and in many cases it is. There are the few, like you're saying, where it takes too long, and we're working on improving that.
Follow up?
Okay, thanks. And my another question I have is, today we were told that fitting rooms are going to be open in retail stores, and since we all know that COVID can be spread by contact of surfaces, how is that possibly going to be safe with people trying on clothes and then putting them back on the rack?
So we've asked, and the retailers will be asked what they're going to do to handle that in the aspects. You raise a good point, and how they're going to do with requiring people with handling of materials. They're doing lots of cleaning, I know, within their facilities, and so they're going to put various, I would say, restrictions and limitations in that. So I haven't seen those details to that, and it's going to be basically to be revealed how they're going to handle that. And if that's one thing is they're doing it, and the next thing, if there's awareness, maybe public will have some concerns because they're going to be as interested in that as the retailer is. So we'll have to wait to see how that's going to be handled to ensure all the safety precautions are in place.
Next question.
Your next question comes from Derek Donana-Rain with CBC News. Please go ahead.
Thank you, doctors. So we're hearing stories of a system that is already overwhelmed and unable to kind of process the test results it has. Despite the importance of expanded testing, if you can't manage the tests you have now, is it wise to be expanding to symptomatic people in the general population?
The current capacity for the labs in Ontario is over 20,000 tests a day. We haven't quite reached that yet, and we're almost completed testing all the residents and staff in long-term care facilities, which has been a huge number of people, a great feat that's been accomplished, almost finished. So with the finishing of that, it will open up room in the capacity to be testing more of the general population with symptoms, because that's where we need to know right now, where are we in terms of the general population, and getting a better focus on identifying cases and being able to follow up with their contacts so that we can reduce and minimize any spread in the population. So we do have the capacity, and with the reduction of long-term care follow-up, we will open up that more capacity.
Follow up?
And we know there are now lab workers, first responders, and hospital staff among the thousands of healthcare workers testing positive for COVID-19. Does the province have any plans in place to further test and protect people in these professions specifically?
So we've, we continue to monitor the situation. We're asking to have some further analysis undertaken in that regard because we want to make sure that if there is any spread among there, especially so-called nosocomial, is that being identified. So some of our different sectors and our partners in Ontario Health are looking at that to ascertain those questions and those points there to do that, and if there's any further recommendations needed, including proper personal protective equipment and usage and training, etc. So all this is part of this overall evaluation that we need to keep assessing and to see if there's anything we can do to flatten that curve as well and keep it down.
Okay, we're going to move on to our last caller.
Your final question comes from John McGrath with TVO. Please go ahead.
Hi, doctors. I'm wondering if you can say, is there, we expect an increase in reported cases as the province reopens, and I'm wondering if you can give us any kind of numerical threshold for what would be sufficiently alarming that it would be necessary to impose new public health measures to close things back down again. Would that be 300 new cases, 400 new cases, 500 new cases a day? What would be the threshold there?
So that's what we're watching with our public health measures table. When you talk about increase in cases, and just because we're going to public testing, we're interested in seeing what is our percent positivity rate in that regard. And it may be lower than we think, and that would be a good thing to see what kind of positivity we're having. If we do get a large increase in a period of time, we'd have to ask a number of questions. Where is that occurring? Is it throughout the province, or do we have, as we've seen now, or sometimes, an outbreak in a large industry, a large area, a large setting, and you may have 100 or 200 cases in that, which means the province writ large is not impacted, but the numbers are. Or you can still have some further aspects in some of the settings, such as long-term care or other congregate settings. So it would be a number of factors that have to play into that. And for our public health team and partners in Public Health Ontario, as well as others, to assess where are the cases coming from, how significant is it contained, yes or no, and if not, if it's going widespread and we see that it cannot be monitored, then we'd have to make a decision. But I can't really say any specific number. Any increases of certain amounts will be always of concern for us if we can't explain how it's been and why it can't be contained.
Okay, follow-up, and this is the last question.
One of the hardest hit long-term care homes announced today that the outbreak is over in that home. Obviously, you expect the testing of long-term care residents and staff to wrap up this week. This has been one of the most important parts of this story so far. Has the long-term care situation stabilized, or is it even now, I don't know if under remission is the right word, but is the threat to long-term care residents finally receding?
Well, I think the situation has somewhat stabilized, but it's still a big concern. The Incident Management System, or IMS table, is meeting daily and reviewing all the aspects. And public health has been working very hard with the hospitals and the paramedics and so on to get the testing done, but also obviously with the long-term care facilities to get the outbreaks under control. And yes, I think in terms of testing, in terms of PPE, infection prevention and control, and human resources, those are the aspects that we need to work with. And it is getting better, but it's still an issue. And there are certain homes that are still what we call red and need more support. And that's why the ministry, the province, did an emergency order the other day. So I think it's still an ongoing concern. Obviously, some outbreaks are finally coming to resolution, but we are identifying some new ones, and so it's not resolved completely. It's an ongoing concern.
Okay, thank you, everyone.